Hello everyone. Hi, welcome to Unacademy. Okay, so let people join, then we'll start the session today. Hi Naga. Hi, so you've joined here from the special class, right? You're one of the top scorers, the top answerers of our special class in biochemistry. Today, I shall be conducting a small test in the special class also. I hope to see you there again, Naga. Okay. So, yeah, let us start. Today, we shall be continuing our discussion about enzymes. It is the third lecture in the series. The first one was there on YouTube yesterday, and the second one was held in the special class. Okay, now this is the third in the series. The fourth one shall be a small lecture in the special class today at 10 p.m., along with a small quiz. Okay, so this platform is a new platform from Unacademy called Unacademy Future Doctors. This is for you MBBS students, so that we help you in your answer writing practice as well as for you to attempt to have a good attempt, good knowledge about how to crack PG entrances. Okay, I'm your educator for biochemistry. The subscription available on Unacademy is of two types. If you go to the app for NEET PG, one is the Plus subscription. Plus subscription comes with access from top educators from all over the country. The other is the Iconic subscription. Iconic subscription comes with Plus as well as the resources from Prep Ladder. Okay, so this is how the interface will look like on the app. You have a heavily discounted price for Plus subscription for 24 months, that is 2 years, but you can avail another 10% off on this by applying my code, that is DRSHUKLA. Here also, if you in the Iconic subscription also, you can apply my code DRSHUKLA for a 10% off. All right. Also, Unacademy is conducting an all India NEET PG combat on 28th November at 5 p.m. You do go back after this class on the app and enroll on that using my code called DRSHUKLA. The enrollment is absolutely free. You just have to unlock the session using my code. Okay. 45 questions in 60 minutes. It will fetch you a lot of uh, morale boosting as well as a lot of rewards as well. Okay, now let us start with today's lecture. Okay, we are going to read about the regulation of enzyme function, right? Yesterday what we read was about the structure of enzymes, the mechanism of action, as well as the enzyme kinetics. Okay, now here we'll take along from enzyme kinetics. Okay, yesterday in enzyme kinetics, what did we read? We left off at Hill reaction, right? Hill equation and Michaelis-Menten constant, Michaelis-Menten type of reactions. Okay, now from that we'll follow here. Okay, first of all, if you have to understand the regulation of enzymes, you should know what rate limiting step or a rate limiting reaction is. What is the meaning of rate limit? Rate limiting means something that stops the rate, something whose presence or absence will affect the rate absolutely. Okay. Now, increase in the quantity or the catalytic efficiency of this enzyme will increase the overall movement of the reaction. Either if if you increase the quantity of the enzyme or you increase the efficiency of the enzyme. If you increase the quantity or the quality of the enzyme, the function of the enzyme, then the reaction will become more efficient. The reaction will progress faster. Okay, so this is the rate limiting step or the rate limiting enzyme. Now, a similar sounding term is limiting factor. Now, what is a limiting factor? If or suppose if there is a reaction containing two substrates, suppose two or three substrates, all right. Now they produce a product. It is coupled with an enzyme. Okay. Now, keeping B and C constant, if you keep the values of these constant, their concentrations constant, then the concentration of A is going to affect how fast this reaction proceeds, right? Yesterday, what did we read? The rate is directly proportional to the concentration of the substrates, right? So if B and C both are constants, this will become 1. This will also become 1. So the rate will ultimately depend upon just this. And this becomes what? The limiting factor. Okay, all right. So keeping the other substrates constant, the variable substrate affects the rate of the reaction. And this variable substrate becomes the limiting factor. Now, why is this reaction called a pseudo first order reaction? Because we are deliberately keeping these constant. Okay, this is what we are doing ourselves. So it is pseudo or it is false. Okay, but in reality, what happens is they will have their own concentrations. Their concentrations will vary. So it will be a third order reaction. 1, 2, 3. Third order. Okay. If you're not getting the order of the reaction, you can go back to Unacademy and watch my lecture yesterday on enzyme kinetics. We had discussed it in detail. I think Naga would know that, right, Naga? You have followed here from the special class. Yeah, so the in reality, A, B, and C will make it a third order reaction. But since we are keeping it constant externally, okay, deliberately we are keeping it constant just to check how A affects the rate, this will become a pseudo first order reaction. Okay, all right. So the limiting factor is defined in a pseudo first order reaction. All right. Now this is the difference between rate limiting step and limiting factor. Okay. Now, next what we are going to do is, about the rate limiting step. I'll give you two examples. Okay. In cholesterol biosynthesis, we are going to read, I think day after tomorrow is your lipid lecture. Day after or maybe after 2 days, you have the lipid lecture on lipids. Okay. Synthesis as well as beta oxidation. Okay. So what happens is this acetyl CoA, what it changes into HMG CoA. Okay. Now this HMG CoA is reduced to mevalonic acid with the help of which enzyme? Can anyone tell me which enzyme? Anyone in the comment section? Allington, Naga. What is this enzyme that changes HMG CoA to mevalonic acid? Okay, so this enzyme is HMG CoA reductase. All right. This enzyme reduces HMG coenzyme A to mevalonic acid, and then further it becomes farnesyl, and then further a lot of reactions go on to ultimately yield cholesterol. Okay. Now what happens is if you inhibit this enzyme, then the whole of the reaction stops. Okay. So this enzyme HMG CoA reductase becomes the rate limiting enzyme. It is the rate limiting enzyme in cholesterol synthesis. Why? Because if you remove this enzyme, the whole of the reaction will stop. Okay. Now, what is the clinical application? What are the drugs that inhibit this enzyme? They are statins. Okay. The people with hyperlipidemia, who have high cholesterol, they are advised statins, right? So these statins, what do they do? Atorvastatin, rosuvastatin. What do these drugs do? They inhibit HMG-CoA reductase. Okay. Now, ultimately, what happens is cholesterol synthesis is reduced. Okay. Another example is fatty acid biosynthesis. Okay. What happens in fatty acid biosynthesis? Acetyl CoA, here as well, acetyl CoA is converted to malonyl CoA. Okay. Now, acetyl CoA converted to malonyl CoA, which will further go on in a cyclical manner to be finally converted to fatty acids. Okay. But the rate limiting enzyme is here. What is this? Acetyl CoA carboxylase. Very good, Allingen. Allingen, very good. Okay. It is also called ACC. Acetyl CoA carboxylase. What does this do? This enzyme, it changes acetyl CoA to malonyl CoA. Alright. Now, this is the rate limiting step. Okay. If this is inhibited, then the fatty acid synthesis will be inhibited. Okay. So, this acetyl CoA carboxylase is stimulated by insulin. That means insulin stimulates fatty acid synthesis. Okay. Fatty acid synthesis is stimulated by insulin and it is inhibited by glucagon. Okay. So, what is the clinical application? In diabetes mellitus, what happens is in diabetes mellitus, there is a deficiency of insulin. If insulin is absent, then this will be inhibited by glucagon and insulin will not be there to stimulate it. Okay. So, fatty acid synthesis will be inhibited. Then what will happen? The person will lose fat. Okay. That is why the extremities are thin. Thin extremities in diabetics, in people with diabetics. Why? Because they have lost fat. Okay, there is loss of fat because of absence or deficiency of insulin. Right. So these two clinical applications we have read for rate limiting steps. One is statins, because they can be asked in the form of short notes. Statins. The other is diabetes mellitus causes wasting of fat. Why wasting of fat? Because insulin is absent. So glucagon will inhibit acetyl CoA carboxylase. There will not be stimulation. Then fatty acid synthesis will be inhibited. Okay. Now, the next terms that we have to remember in enzyme regulation are enzyme inducers and enzyme repressors. Okay. What are enzyme inducers? Enzyme inducers are some molecules whose presence is needed for synthesis of enzymes. Okay. The enzyme will not be synthesized if enzyme inducers are not present. Okay. For example, if you see, this is a culture plate. In microbiology, what we do, we culture bacteria, right? So this is a culture plate containing glucose. Okay. Now, if you culture E. coli over it, if you uh, put a few strains of E. coli and leave them overnight to see their chemical activity, if you want to see if they have lactase activity, right? If they can break down lactose, then what do you have to do? You have to add the enzyme beta galacto, you have to add the molecule beta galactoside on this. Okay, what is beta galactoside? You have to impregnate this with beta galactoside. Now what happens is the enzyme beta galactosidase, which is already present in E. coli, it will get activated, and then it will break down the lactose. Okay, without the addition of these beta galactoside molecules, the E. coli was lying dormant. Okay, the beta galactosidase enzyme in E. coli was lying dormant. It only got activated, or the synthesis of the enzyme only started when this inducer, what is the inducer? Beta galactoside. When this inducer was added to the culture plate. Okay, so this is an example. Now, one very important group of enzymes is the cytochrome P450 enzymes. They are present inside the liver. Okay, and they are involved in detoxification. Okay, they are involved in detoxification. Most of the drugs, most of the toxins are detoxified by cytochrome P450 enzyme. Now, why is it special? It is special because it is a highly inducible, as well as highly, it can be inhibited as well. Okay. Now, what happens is when certain molecules are in excess, certain molecules, what see, so this is about cytochrome P450. We'll come back to it later on. So we were discussing about inducers. Now we'll come back to repressors. Inducers were those that increase the synthesis of enzymes whose presence is needed to synthesize enzymes. Now what are repressors? If they are present in excess, then the enzyme synthesis will be stopped. It will be curtailed. So they are opposite of inducers, right? Now, we'll read about cytochrome P450. Okay, it is a very important short note question, right? So cytochrome P450 inducers are those drugs which induce the formation of the synthesis of this enzyme. If these drugs will be present, they will increase the synthesis of cytochrome P450. If these drugs will be present, they will repress or decrease the synthesis of cytochrome P450. Okay. Now, if cytochrome P450 is in excess, what will it do? If cytochrome P450 is in excess, okay, and if it is deficient, what will it do? If it is in excess, it will detoxify, or it will metabolize the drugs. If the drugs are metabolized, their concentration of drugs will increase or decrease. If the drug is getting metabolized, its concentration will increase or decrease. Tell me. If the drug is getting metabolized, the concentration of drug will decrease, right? It will decrease. Now here, cytochrome P450 is reducing. So it will not be available to metabolize or to detoxify. So the metabolism of drugs will reduce. Metabolism of drugs will reduce. And the concentration of drugs will increase. So this is another applied concept here. Very good, Nagan. Very good. Your concepts are very clear. Right. So another clinical aspect I'm going to discuss with you, how the inducers increase the concentration of cytochrome P450 and decrease the concentration of drugs that are metabolized by this. Okay. So, if you give rifampicin and phenytoin together, what will happen? they will decrease each other's concentration, right? Because inducers are decreasing the concentration of the drug. So rifampicin and phenytoin will decrease each other's concentration and the effect of the drug will not occur. Phenytoin is given for seizures, for epilepsy. If someone is taking phenytoin with, suppose if there's a patient of TB, he has been advised rifampicin and he also has seizures, suppose neural TB, okay? So he also has seizures, he will be given phenytoin for epilepsy. Now you have to remember that you have to adjust the dose of these two because they are inducible. They induce each other and they will decrease the concentration. So if 400 milligrams of phenytoin is required in a normal patient, in a patient with rifampicin, you will require more than 400 milligrams. Okay, understood or not? And the opposite happens with inhibitors. The inhibitors, they can cause drug toxicity, right? Itraconazole, if itraconazole is given, itraconazole is an antifungal drug, erythromycin is an antibiotic. If itraconazole is given with other drugs, it will increase the concentration of drugs, okay? So in a normal person also, toxicity can happen with normal dosage. Okay, if you give, so that is why you have to keep in mind if the drugs that you are giving, you're combining, are inducers or inhibitors of cytochrome P450. Understood this concept? Very important concept. Okay, right. Next is feedback inhibition. There are two terms, feedback inhibition and feedback regulation. Okay, now what is feedback inhibition? It is negative allosteric effection or feedback inhibitor is a negative allosteric effector. In the last class on Unacademy special class, we had read about what is allosteric enzyme. Okay, what is an allosteric reaction? That means it is a molecule that occupies a site of the enzyme. It occupies a site other than the active site. It will occupy a site other than the active site and it will increase the uh, catalytic property of the active site. Okay. All right. So this is what this molecule is the effector molecule. Okay. Now what is negative allosteric effector? When this decreases the property, catalytic property of the enzyme, it will be a negative allosteric effector. Okay. Excuse me. So feedback inhibition means when the product behaves like a negative allosteric effector for the substrate. So here this product will behave like a negative allosteric effector for this substrate. Okay, this product will inhibit this substrate, feedback inhibition. This will inhibit this. Okay, how? This product will go and occupy a site on the substrate and prevent further reaction. This product will go and occupy a site on the substrate and prevent further reaction. This product will go and occupy a site on the substrate and prevent further formation of this. Okay, this is what feedback inhibition. Okay. Now, what is the difference between feedback inhibition and feedback regulation? We'll come back to it later on. Next is an example of allosteric activity or allosteric feedback inhibition. What is it? Aspartate transcarbamylase, ATC. Earlier we have read about ACC enzyme. What was it? Acetyl CoA carboxylase. Now this is aspartate transcarbamylase, ATC enzyme. What does this do? It is involved in pyrimidine synthesis. What are pyrimidines? Can anyone of you tell me? Pyrimidines and purines. Pyrimidines and purines. Okay, I think it is easy because you guys already know quite a lot. So, pyrimidines are C and T, purines are A and G. Okay, if you have any confusion, if at all, you can remember as pure silver. Okay, pure silver. Silver is what? Ag, right? Argentum. Ag is the chemical symbol. So this can be your mnemonic. Pure silver. Pure Ag. Ag are purines, and the other two, C and T, will be pyrimidines. Okay, cytosine, thymine. Okay, right? So in pyrimidine biosynthesis, the most important enzyme is aspartate transcarbamylase. What does it do? From the nucleotides. The nucleotides will be acted upon by ATC, which will form this. Okay, yeah, very good, Naga. Which will form cytosine. Okay, cytosine. Okay. Now, there is this enzyme called CTP, okay, cytosine triphosphate. Cytosine triphosphate inhibits ATC. Why will it inhibit ATC? Through feedback inhibition, because cytosine is the product of cytosine is P1. It is the product, and S3 is the nucleotide. Okay, so this CTP enzyme will inhibit ATCase, but ATP will activate it. Okay, CTP is the product. It will inhibit this enzyme, but ATP will activate this enzyme. Okay, so what is the clinical application? Clinical application is high levels of purine nucleotides will enable the synthesis of pyrimidine nucleotides. If suppose you have a lot of purine nucleotides in your body, then automatically the reaction shifts towards synthesis of pyrimidine nucleotides. Why? Because purine is ATP. So ATP will activate ATCase, which will start the formation of cytosine and thymine. Okay, right? Got it? Next, so now we have to discuss the difference between inhibition and regulation. Okay, what is the difference between feedback regulation and inhibition? Feedback regulation is curtailment of the expression of the gene encoding for the enzyme. We have read about enzyme repressors, right? What are enzyme repressors? They cause feedback regulation of the enzyme. Okay, they cause feedback regulation of the reaction. How? Because they will inhibit the the expression of the gene. Okay, while what the feedback regulation is inhibition of gene which produces the enzyme. Gene producing the enzyme will be inhibited, so the product will be inhibited. The product will not be formed. Product will be decreased concentration. Okay, while in feedback inhibition, what happens is the product will cause allosteric inhibition. Okay, allosteric inhibition of substrate, which leads to decreased concentration of products. Okay, right? Got it? What happens here? The product is itself going and binding on the substrate, and that is giving it the signal not to go and produce further product. Okay, this substrate is forming the product. This product is giving it the signal to, it's binding on it and giving it the signal to stop forming further product. While here what is happening is when this product is occurring in excess, see, an excess of the repressor, an excess of this product will go and it will inhibit the gene producing the enzyme. If the gene is it is acting at the level of gene. Okay, right. Now one more important thing we'll discuss, and then we'll stop the lecture today. We'll meet in the special class today at 10 p.m. Okay, all of you remember there's a special class at 10 p.m. on Unacademy platform. I wish to see the regular people there because we'll have a quiz also, a short quiz. So you guys prepare all the lectures, revise the lectures and come in the special class today at 10 p.m. on Unacademy. Okay. And use my code DRSHUKLA to unlock the lecture. Okay. All right. So the last thing is competitive versus non-competitive inhibitors. What are competitive inhibitors? Competitive inhibitors are those that mimic the substrate. Competitive inhibitors are, they mimic the substrate in their structure. Okay, like succinate dehydrogenase enzyme, it changes succinate to fumarate. Okay, succinate dehydrogenase enzyme. Now it is inhibited by malonate. Why? Because malonate mimics what? It mimics succinate. Malonate looks like succinate. Okay. So it goes and sits on the active site of succinate dehydrogenase and it prevents succinate from sitting on the site. Okay. Got it? So they see the competitive inhibitors and the substrate exert reciprocal effects on each other. We can understand, right? Now, the competitive inhibitor has no effect on Vmax. What is the Vmax? Vmax is the maximum velocity that a reaction can attain. Okay, in the last class we have read in the special class on kinetics. So, if this is the enzyme, it has this active site. This is the we have this substrate here and we have this competitive inhibitor. Now both look the same, both can fit over here. So any of which can fit over here. So the speed with which the enzyme will change into the enzyme inhibitor complex or the enzyme substrate complex is the same because both can attach on this. Okay. But that is why there is no effect on Vmax. But what happens is for the substrate to attach on this, it has to increase in concentration. Okay, there is a competition between the substrate and the inhibitor. Okay, so the substrate has to increase in concentration for it to occupy the active site. Okay, so that means that its affinity is getting reduced, right? Because the affinity is getting shared with this. The enzyme is also the enzyme is readily accepting this also and this also. So the affinity for this is reducing. So what does it have to do? It has to increase its concentration. Suppose this is a girl and these are two suitors. Okay, these are two people wooing this girl. Now this girl has equal amount of love for this also, for this also. Now what will this person do to make sure that this girl chooses him? He will have to give her more gifts, right? More flowers. He will have to shower her with more love than this person. So the love or the affinity is what? Km. So the presence of a competitor will increase the Km of this. Okay. All right. Got it? And non-competitive inhibitor, what will it do? Since non-competitive inhibitor, it does not matter whether the non-competitive inhibitor is present or not. The non-competitive inhibitor will just go and occupy the active site and the enzyme will keep on and the substrate will keep on staring at it. It will be left like that. Okay. So but this enzyme inhibitor complex cannot perform the function. This enzyme inhibitor complex cannot produce the product. So what has happened? Its efficiency has reduced. But if this inhibitor was not present, then the affinity is the same for this. Okay, the affinity has not been affected. So in competitive inhibitor, Vmax has not been affected or efficiency of the enzyme has not been affected. In non-competitive inhibition, the affinity of the enzyme for substrate has not been affected. Okay, always remember Km denotes affinity, Vmax denotes efficiency. So always in MCQs you will be asked non-competitive inhibitor lowers the Vmax, increases the Vmax, lowers the Km, does not affect the Km. So but if you remember, Km denotes affinity, Vmax denotes efficiency. Okay, and if you remember this story of a girl and two suitors, then you will understand how competitive inhibitor acts and how non-competitive inhibitor acts. Okay, all right. Naga, Km is equal to Vmax by 2. Km is the substrate concentration at which velocity is equal to Vmax by 2. Okay, Km is substrate concentration, Vmax is velocity. We cannot equate them, they are different dimensional units. Okay, Km is the concentration of the substrate at which the velocity of the reaction is equal to Vmax by 2. Okay, they are not the same units. Okay, feedback, inhibition versus regulation. Naga, okay, I'll try and do it. Actually, the time is very less. We are given, okay, I'll try and, what is your doubt? Can you tell me about feedback, inhibition and regulation? If not, then I'll take it again in the special class, all right, if the time goes up here. Feedback inhibition. What is the meaning of feedback inhibition? Feedback inhibition is allosteric in nature. Allosteric means it occurs at the level of enzyme. What is enzyme? Enzyme is a protein. Protein is a gene product. Okay. Now, if this substrate has been acted by an enzyme, the enzyme causes it to form a product. Okay, the enzyme was produced by a gene. This gene has produced a protein which is an enzyme, and this enzyme is acting on this substrate to form this product. Now, in this reaction, if this product will inhibit this substrate by attaching onto it, then it is a feedback inhibition. But if this product is increasing in concentration and it is going towards the gene and it is signaling that please stop my production, I have already become too much, then it will become feedback regulation. An example of feedback regulation is how hormones act. Okay. In hypothyroidism, what happens is, or in hyperthyroidism, what happens is T3 and T4 hormones are in excess. Now, what do? They go and signal the brain, the hypothalamus, that please stop secreting TSH stimulating hormone. So TSH gets reduced, and when TSH gets reduced, then again T3 T4 concentration will get reduced. Okay, so if this product acts at the level of gene, then it is feedback regulation. But if this product acts at the level of the enzyme is a product of the gene, then it is feedback inhibition. Okay, all right. Yeah, so that is it for today. We'll continue the this discussion as well as applied clinical concepts and questions in the special class at 10 p.m. today. Everyone, do go and register right now on Unacademy special class. Okay, Unacademy special class. Okay, use my code DRSHUKLA to unlock the session. Okay, it is absolutely free. It is at 10 p.m. All right. Yeah, good, Naga, good. All right, thank you. See you all. Thank you for your patient hearing.